Hi everybody, I'm Dr. Stephanie Davenport. I'm one of the Pediatric Emergency Room doctors at CHEO. Today I'm going to talk to you about fever. Fever is one of the most common things that we see in the emergency department. We know as parents and as healthcare workers that fever can make a child look really unwell. So here are some tips about fever. Firstly, fever in and of itself is not an emergency. Even if that temperature is quite high, it does not mean that your child is more sick. Fever is the body's natural response to an infection. Most of the time, infection in children that causes fever is from a viral illness. Viral illnesses are treated with fluids, lots of rest, and time. Most of these types of infections do not require antibiotics. You can also support your child by giving them Tylenol, also known as acetaminophen, or Advil, also known as ibuprofen. These medicines can help lower temperature even if they don't get rid of it, and they can help to make your child feel better. If in between periods of fever your child is playful, this is very reassuring. Tylenol and Advil do not mask serious causes of fever. But here are a few reasons we do need to see fever in the emergency department. Firstly, if your child is 3 months of age or younger and has a rectal temperature of 38 degrees Celsius or higher, we need to see that in the emergency department. We need to see any child or teenager that has a fever who has a complex medical history or has any reason to be immunosuppressed. Anytime your child has a decreased level of consciousness, they're not moving their neck, or they look really unwell, we need to see those children with fever in the emergency department. Anytime your child has 5 consecutive days of fever, they need to be seen and assessed by a medical professional. That does not necessarily mean in the emergency department, but we're obviously here if you're concerned. Ultimately, you know your child best, and if you are really concerned, we are always here for you.